A really powerful pranayama practice for hormone balancing is Nadi Shodhana. And Nadi Shodhana can be particularly powerful when we also bring pelvic floor awareness to it. Surprise, surprise. Nadi Shodhana ticks the boxes of what it takes to move a nervous system from a very stressed, unresourced state to a balanced, resourced state. And that is because we utilize the two principles that Professor Herbert Benson, came up with to elicit the relaxation response. So the relaxation response is that response that takes our nervous system into rest and digest, and this gives us better blood flow to the pelvic and abdominal organs, and this also settles our blood pressure and our respiratory rate down, our heart rate down, and this is particularly therapeutic if we've been experiencing issues with our hormonal system. So with Nadi Shodhana, we tuck the right elbow in by the side. We keep the shoulders relaxed. We try and keep the pelvis balanced so that the left and right sitting bones feel even. And we use the index finger and middle fingers to either touch the third eye point or fold them towards the palm of the hand if that's not too uncomfortable. We might need some tissues to clear the nostrils, but if the nostrils are clear, we're going to slide the thumb and ring finger down the bony part of the nostril, the bridge of the nose, to the fleshy part of the nostril. And the very first part of Nadi Shodhana is closing the right nostril using the thumb to inhale then through the left nostril. Hold the nostrils at the top of your inhalation phase briefly closed. Release the right nostril by releasing the thumb and exhale through the right nostril. Inhale back through the right nostril. Hold both nostrils closed at the top of the inhalation. Release through the left nostril as we exhale. Now, bringing pelvic floor awareness to this means actually understanding that on our inhalation phase through the left nostril, we may or may not experience a heightened awareness of the left pelvic floor muscle softening and opening on the inhalation. As we hold the nostrils closed at the top of the inhalation and release the right nostril, we have an opportunity to bring awareness to the right side of the pelvic floor. And usually on an exhalation phase, the pelvic floor will move towards the body. As we inhale, the pelvic floor will move away from the body. Perhaps our intensity is more aware of the right side being on the right nostril. We hold at the top of the inhalation, we release the left nostril and exhale through the left nostril, which may or may not bring a heightened awareness to the left side of the pelvic floor. And we must remember that pubococcygeus specifically, and levator ani, which runs from that pubic bone to the tailbone, will actually often present with a slightly different right side to left and vice versa. Nadi Shodhana is a balancing practice. It balances the left and right hemispheres of the brain, and it gives pretty much any constitution, whether you're Vata, Pitta or Kapha, a good opportunity to restore balance.